I'd like to invite up to the table our client panel. And we had a lot of discussions or a lot of feedback last year after Cypress University that people wanted to hear from our clients. And so we got some volunteers to come up and do this for us. This is an experiment, so we don't know how this is going to go. But what we want, really, our goal here is to have some of our clients tell you about what their experience is, what they're doing, how they're doing things, and then hopefully we get some questions from you and we get some discussion going. The point of this is not to have them tell you everything. The point is for you to kind of share some of your experience as well. So hopefully that's what's going to happen. 3 clients, great clients and longtime clients. John DeBoer was the vice president and CAO for Midwest Laboratories in Omaha, Nebraska. What is a CAO?
Chief Administrative
Officer. I probably should have known that, huh? Tammy Bladorn, Human Resources Manager from Keller in Appleton, Wisconsin, and Brian Voss, who's the Director of Human Resources for Miller St. Nazianz in St. Nazianz, Wisconsin. So we've asked them to kind of give a little bit of background on who they are and what they're doing, and then hopefully that will generate some questions from some people. I did want to, so we're going to start with John. I took a look at their experience with us over the last several years, since they became a client. And just so you know, John has been very active and very successful at doing stuff with his medical plan, and he's averaged from 2009 to 2013 a total of, not an average, he has increased, his costs have increased by 3.3%. That's pretty good over the course of 5 years. So why don't you tell us how you did that? If you want to come up here and do that, you want to do that there? Yeah, come on up. All you have to do is just press the down button.
Press the down button, get it? Okay. As he said, I'm from Midwest Laboratories. Midwest Laboratories is a non-medical laboratory. We're in Omaha, Nebraska. I hear Nebraska comments every once in a while around here. We're heavily agricultural in Omaha, and consequently our lab is also heavily agricultural. We do a great deal of the soil testing that's done in the United States. We do a great deal of the testing of pet foods for companies that manufacture pet foods in the United States, as well as environmental, microbiological, and a full gamut of testing laboratories. We have 8 buildings that have different laboratories in them. We've been in business for 39 years. We've been self-funded for probably over 20 of those 39 years. And so we're kind of familiar with self-funding. It was fortunate. We're actually a break-off of a company out of Memphis, Tennessee, and they had started self-funding down there like 30 years ago, which is amazing. Back then it was kind of an unusual thing. And so when we bought out the company and brought it to Omaha, we found someone who would help us with setting up a self-funding program in Omaha. We've probably been through about 7 TPAs over the years. Some of them have been bad experiences. Typically, they've been small TPAs directly from the area, and some of the fact that we've had so many is that one would kind of have trouble and somebody else would buy it out. A little bit bigger one would buy it out, and maybe the service would improve a little bit, and then they'd maybe pass it off to somebody like a life insurance company that thought they could do it, and then everything went down the tubes. There were times that I would have people in my office a couple times during a week because they had problems with claims that were covered by the plan, and they couldn't figure out why they weren't being paid. So it was a rough situation. Finally, probably about 9 to 10 years ago, we got hooked up with a company in Omaha, HDM. And we had, for instance, Michelle was with HDM back then, and we started having a lot of success as far as getting our claims paid. That was our first goal, is to get that taken care of properly. And that happened then. And about 5 years ago, the HDM company was purchased by Cypress or joined by Cypress and so forth. And at that point in time, we did some reassessment. First slide I want to show you is something that I worked up just kind of out of curiosity on my own. What this shows is the different types of services. I broke it up into several categories. The top category up there is what we pay to have someone administer our program. In other words, write the checks and do all that business. And that's basically what we pay to Cypress. And the total on that of our whole plan is just 2.9%. Now that felt pretty good to me, that it was only 2.9% I was having to pay for those, quote, administrative type fees. The next section I called money-saving options. They include the PPO, the MAP program, Consult-A-Doc, and I'm having a hard time reading that one. I'll read it off my own. And utilization management. So those are parts that I feel are saving us money. They're not really, I mean, they're a cost to us, yes, but they're a cost to us that's going to save us money. And the total cost or the total percentage on those is 1.6%. So now I'm down to the point that we do have a company in town that is our agent, Grace Mayer Insurance. They're a large company in Omaha. And they are our agent, and we pay them 0.6% as our agent, linking us up to Cypress and all of the others. Something new I added this year was transplant coverage. That costs me 1.9% to cover the potential of a transplant. And that is, as far as dollars, that shakes out to be about $20,000 this year to cover transplants. Well, as you'll see later, I have a pretty good, what I call my nest egg, and that's the amount of money we've accumulated over the years that we have to enable us to take more risk. And what I've assumed on the transplant insurance is that's helping me save my nest egg. That's a little insurance to keep me having that nest egg in place. The total then, and then I've got the stop-loss carriers, and that ends up that between the transplant insurance and the stop-loss carriers, that's 13.8% of my cost. So I get a total of 19.0% for all those plans that do everything except for the dollars that pay for employees' bills. And that ends up being 81%. So 81% of all the money that goes into that plan is used to pay employee costs and medical costs and so forth. And it was kind of interesting to come up with those numbers. And it'd probably be a good idea just to do that with your own plan and just see how your levels are working out. It might surprise you. It really surprised me. So let's look now at our plan over the past, well, actually, it's past 10 years. What you'll see here is between 2005 and 2014, first of all, the blue numbers there are what our premium was, the premium that was paid for, and this is all based on an individual plan. For an individual plan, that's the premium from 2005 to 2014. Remember, the whole time we've been self-funded. And so the plan cost per employee was from $372 at the top to $562 at the bottom. The caveat on this is that I pay the full plan. I pay the total cost of the insurance for every employee for their individual plan. So you'll notice about 5 years ago, I bumped it from $395 up to $520 and then $562. Now, down on the lower right hand here is my reserve fund. The red here is my reserve fund. You notice in 2008, I had kind of a bad year as far as my reserve fund. I wasn't putting enough in. If you look at my premiums, I wasn't putting enough in to really support the plan. I had a bad year. So I started increasing the amount over here. I started increasing the amount that I was going to put in as a premium. Again, it's my option to do that since I'm paying the full bill. So I increased that premium at that point in time to where I got to the $562 amount. And the interesting thing was that was the same time that Cypress came into Omaha. I increased my premium for two reasons. One, I'd had kind of a low year, and Cypress started introducing me to all these programs for money saving. And so I decided, okay, I've got to put out some money in order to save money. So I started buying into some of these money-saving programs, and look what happened to my reserves. I've kept my premiums level for the past 5 years, and my reserves have climbed from the bottom down there of $388,000 to $1,199,000. Now, I've gotten to that 2 ways. One, I buy these programs that help save money from Cypress, put a little money into saving money, and the second thing that happens in that whole thing is that it's gradually climbing, and yet my premium is staying flat. So not only is the money accumulating because I'm not doing it, but also I'm covering myself over here with different aggregates. You notice it was $30,000 flat as a specific way back in the early years. And then as I started doing this process of getting involved with Cypress and so forth, we started exploring. So we jumped to $40,000, and then we jumped to another $40,000 spec aggregate. And eventually got up to where we are this year, where it's $50,000 and $25,000. Well, as I move those up, as I've got dollars here to cover myself in case I have some problem, I move the numbers up that I take as self-retained, and consequently then my premiums are lower and I'm building more money. And that's one of the other reasons. So by buying the programs that help me save money and also taking larger risk for my plan, that's the way we're getting to this point of saving more money. Now I've gotten to the point, interestingly enough, where that amount in reserve would be adequate to pay for my entire medical plan for a year. Now, if I were fully insured and I were paying this money to an outside agency, who could tell me what I'd have left in this column where I now have $1.2 million? Zero. So now I've gotten to the point where by paying a little extra, this was like a $125 jump here a month per employee, but by paying a little extra there and getting some money in reserve so that I can be more creative with the programs that I buy and the stop-loss coverage, we're in great shape. We've got enough to cover us for a year. Really, a success program for self-funding. And as I started putting these numbers together, it got me really excited, and that's why I wanted to tell you about it. And interestingly enough, too, the point right there where I started doing all this is when Cypress came into my life. And Michelle was very, very helpful in getting us to this point. She kept coming up with suggestions and so forth, and that's how we've gotten there. Pretty simple story, but it works.
That is a great story, and you're so right. I mean, if you were fully insured, none of this would have happened.
Right.
So
there is one thing I forgot to say.
you can use the microphone if you want.
There is one other thing that I would like to say, too. In doing this, our copay is where it was 20 years ago, $10 per visit. If you go to a specialist, it's $10 per visit. Our deductible is $300. Our out-of-pocket is $700. Now, what year are those out of? Those are out of probably 15 years ago. And so we are helping people with that. Our whole goal is to try and do the very best job we can for our employees. We really aren't trying to save money in this thing. We're a service organization. Our employees are everything. They're all science-minded people. We don't allow any smoking anywhere on campus, so if they want to smoke, they have to check out, leave campus, and then come back. That's been a benefit for us, too. We have an almost no-smoking community of 129 people. And I forgot to say that.
Oh, great. No, that's great. Thank you very much.
Tom?
Yeah.
Real quickly, one of the things that John did that people might not know about, but some of our employers already integrate, is the one-call medical, where they put the number on the back of the ID card, and it's an option to drive people who are having scans and things like that to an alternate medical facility. In this situation, they were going to a freestanding facility, and I just mentioned this because John had some numbers on the board, and just before we left for Cypress U, we got a savings analysis, and he had several people who had gone and used that program, and that's a free program, so it's just giving people the opportunity as they're, using those services to seek care at an alternate facility at an alternate facility. And I think on your savings alone was over $2,000 just for that program, for one facility or for one utilization, and the other one was, I think, $1,700. So you had quite a significant savings in one quarter for two people who just alternately utilized care, to seek care at a more cost-effective facility.
Yep, and that's what it's all about, right?
I actually ended up myself having to have hernia repair late last year. And I'm 67 years old, hadn't had surgery since I was 6 and had my tonsils out. I really didn't know what to expect. I called I self-diagnosed. I knew I had it. I called a MAP, and I said,
by the way, there are some providers in this room that might not like to hear you say that.
I called them, and I said, this is my situation. I bought this program for our company. If I expect my employees to use it, I better use it myself. What can you do for me? She said, I'll call you back in 3 days with doctors. She called back in 3 days with 3 names. I called one of them. I went into the office. He told me what he was going to do. He was going to put me in twilight sleep, not put me totally under. He was locally anesthetize me. And it was going to be at a surgery center that was connected to a hospital, but not actually a hospital surgery center. So I reported in the morning at 8 o'clock when I was supposed to. At 9 o'clock, they took me in. At 11:30, I woke up. At 12 o'clock, we went to Panera for lunch. I was pretty pleased with that because I was really, really intimidated by what the possibility was going to be. I've heard of people having hernia surgery and not being able to lift anything forever. They told me 20 pounds for the first week, and then I could add 10 pounds a week after that. So that's my story of using that program. It really worked for me, and I was very pleased with it. And I've told the employees the same stories, too, to try and encourage them to look at those programs to help themselves.
Yeah, we should explore a little bit more during the question and answer session about those kinds of things. But I want to introduce Tammy from Keller. This is maybe my favorite of the 3 slides looking at costs. If you take a look at, and remember, the national average for medical expenses is about $1,132 a month per employee. You can see what Tammy's experience has been, and since she's been a client of ours since 2008, their costs have gone from an average of $634 per employee to $641 per employee. That's 0.1% increase over 6 years. So she's doing something right, and we like to think that we're helping her. So, Tammy, why don't you come up and tell your story?
Can I stay here?
Oh, you want to stay there? Sure.
Do you have a clicker?
Oh, absolutely.
So is it for you? This one? Okay. All right, I just don't want to drop my notes all over the place. So again, Tammy Bladorn from Keller Incorporated. I'm the HR and benefits manager there. I've been with Keller for just over 9 years, and I can say immediately walking in the door to our company, you can just feel the culture like none I've ever seen or heard of before. We are 100% employee owned, so my story is going to be based on that, just talking about the culture and how we truly get our employees involved and get them to have a vested interest in cost-saving measures with us. So,
If the clicker's not working, I can click for
hey,
you. Oh, there you go.
So that's Keller. So what do we do? Keller was founded in the state of Wisconsin, 1960, by Walter Keller, who still sits on the board of directors for our company at 83 years old, so he's very vested in his company. We are a design-build general contractor in Northeast Wisconsin. Most of our work is performed in Northeast Wisconsin and the outlying states. Often our customers will take us out of state, farther away, Florida, Colorado, Hawaii, to do their buildings for them there. And basically, our customers vary, anyone looking to do building with a commercial or agricultural building or addition. So some key benefits for employee owners. I'm going to touch on the employee ownership last, but we also do offer 401k, pre-tax, and Roth options, which both include a company match. Our self-funded medical and dental plans have been very successful. We'll talk about that a little bit more. And the third benefit is our ESOP, so Employee Stock Ownership Plan. Basically, our employees earn stock in the company. It's 100% contribution by the company, and it's based on their total compensation for the year. Some benefits of employee ownership. Employees receive incentive bonuses based on company profitability. So naturally, each employee has a vested interest in providing the best services to our customers, working effectively and efficiently, among other things. We have been employee-owned since 1986. So 28 years, we would be considered a mature ESOP. And employees of Keller have received annual stock contributions averaging 10 to 13% of their total compensation. So the ESOP is a big retirement tool for us. Over 50% of our current employee owners have over six-figure balances at this point. It's a very big retirement tool, and it keeps everyone vested in, again, cost-saving measures. The culture is really what I want to touch on. It's a major attribute to our company's success, and it bleeds into everything, including our medical plan. We believe that as owners, all employees have more to contribute and believe that they should be essentially in turn given back and share, to be able to share in the success of the company. So our self-funded healthcare plan, we have been self-funded since 1995. Success of our plan, again, I can't hit it home enough, is the culture. And I realize that every company can't be employee-owned, and that's kind of not the angle, but just to prove to you that to really get your employees vested in what you're doing is huge. They need to know what your plan is, what it means, the programs that you have in place, because they're the ones that are using it. They're the ones that need to know on a Saturday afternoon, what do I do? You know, my child has strep throat or something along those lines. You don't want them running to the emergency room necessarily. So we talk to them about quick care options, things along those lines, because essentially that's going to save them money and it's going to save the plan money. Teaching consumerism is essentially that. Just getting them to understand that it's okay to question your doctors, to make sure that you're getting the most affordable care options and not just being pushed into decisions because that's what they want you to do. I think we can all agree that entitlement might be an issue in our upcoming generations. And as much as that can kind of be a bad thing, we like to do it in the reverse, to say that, you know, honestly, if you're going to help us out, if you're going to help the company make some cost-saving decisions and do the right thing, you should be entitled to share in the success of that by lower premiums, lower deductibles, things along those lines. And education is huge. I will say, you know, I'm hoping to get some feedback too from other people, but our employee base, being a construction company, over 60% of our employees are not located at our company, at the office. So education's tough. You're not right in front of them all the time. So to be able to get out there and get the disconnect, to remove the disconnect. You know, we do paycheck stuffers and we have an intranet, things along those lines, but we really try to rein in our employees every, at least twice a year, if not more, group meetings, invite the spouses, to get people involved, to get them to ask questions, to get them to really understand what we're doing and how the plan can work for them, and to celebrate our successes, because that's important too, so that they understand what we're doing. We have had stability with our stop-loss carrier. We're going on our 7th year with IHC, so that helps with our renewals and things. Also allowing us to have early sign-ons to get our rates locked in. And continued success, we have been able to remain grandfathered since the ACA. We have had no major plan design changes in order to keep our grandfathered status. Our premiums and deductibles have remained unchanged for the last 4 years, which again is a huge retirement tool for onboarding new employees. We implemented a prescription co-insurance plan. Essentially, we took our prescriptions away from counting towards deductibles and just promoting consumerism with a cost-sharing approach. So employees pay a percentage for every prescription that they get. So obviously, try the generic first. Doesn't work for everybody, but they're going to essentially pay less. The plan pays less. We also implemented the one-call medical that Holly just mentioned in 2013. And again, just using it for MRIs, CT, PET scans. It shows right on the medical ID card. So when they go in, that they are supposed to essentially check for better options, for more affordable options. And we kind of told our employees too, having it on the card, it takes a little bit of the stress of the employee having to say, no, you need to check for something cheaper. We tell them, essentially, my employer's making me do it. So they put the pressure on us, and it takes it away from them. Makes it a little bit easier of a conversation to have. And again, same example that Holly mentioned, pretty relatable, is a simple MRI. This is kind of a sad story, but I think it's really the way things have become. So our employee went in he needed an MRI, and the clinic, the doctor that he was with, wanted him to use the hospital, essentially. And, he came to me and we had just implemented it, what do I do? And so we called, and the MRI clinic down the road was going to be a much more affordable option. He tells the doctor about it, and the doctor says, well, you can do that, but there's a good chance that I might not be able to read the scan. It could be fuzzy, and if we can't read it, then you're going to have to go to the hospital anyway. So he comes to me, and what should I do? And I'm like, well, it's honestly, it's your decision, but it's history. The facts have shown us that that's not the case. It's a very successful MRI center. He went in, everything was perfect. He ended up paying about $600 in comparison to a $2,200 hospital scan. So things like that. But it is sad that, the industry has kind of made that difficult for us as consumers to believe them. And they say, how come, I can't trust my doctor? And it's not necessarily that, it's just there are other ways to do things. And we also changed our PPO back in 2009 with Cypress, which allowed us to increase our discounts from 18% to 32%. This is a huge savings for us. So this is just a little bit of an outline of last year, 2013, comparing Keller to the study, the Midwest study. So we're not quite as good as John's, but our per employee per year, $6,800 average, which is huge, compared to $11,000 average cost per employee. The employee's portion of the health care plan is approximately 11%. We do have a four-tier plan. So they pay approximately 11%. One of the things we do with onboarding, so the first year at Keller, at Keller you do pay 50% of the premium. And then at your 1-year anniversary, it reduces to 11. Again, it's getting that employee onboarded, buying into the culture, understanding the benefits that they're going to be receiving. Our annual deductibles have remained at $750 single, $2,250 family, and the middle tiers are $1,500. Office visit copay is remaining at $20 per copay compared to $25. Our coinsurance for services is at 90% compared to 80%. Out-of-pocket maximums are at $1,250 and $2,750 for families, so just $500 more than the deductible. And remaining grandfathered, And also our participation in the plan is 89% compared to 58%. So again, getting our employees to buy into the employee ownership, the culture, being good consumers, being accountable for everything they do pays off in the end with some really good benefits. And going forward, yesterday one of the members of the panel talked about having the trifecta and keeping your costs down, and we have been with Cypress since 2006, and also our stop loss carrier, IHC. We did make a broker change last year, but having those good relationships really helps as well in keeping things low cost. 2014 and beyond, I'd like to learn, I think we're going to learn today about the telemedicine, implementing a surgery network, obviously ACA compliance, continuing with that, taking a look at additional pre-certification requirements just to make sure that we are on top of what our employees are doing and what their health concerns are, and then also worksite wellness. So hoping to get some feedback on what everyone else is doing with those programs as well.
Great. Thanks. Awesome. You know, so there's the consistent theme, right? I mean, educate your employees, take advantage of the programs and the services that we're bringing that really do save money. I mean, so we're 2 for 2 in that. And so we're going to see if Brian can knock it out of the park as well. Brian, you want to sit there? Or you want to come up here?
I'll sit here.
All right, make sure you're close to the microphone. Just so you know, Miller St. Nazianz, as I indicated, is in St. Nazianz, Wisconsin. They've been a client since 2009. And you can take a look at their experience as well. They're well below the national averages. Perhaps you know, not as crazy as Midwest Labs or Keller in terms of keeping their costs down, but a successful program nonetheless. And so, Brian, if you want to tell your story, that'd be great.
Okay, good morning. My name is Brian Voss. I'm the Director of Human Resource for Miller St. Nazianz. We're also in agriculture. Excuse me. We're a manufacturer of application spraying and forage baking equipment, and there's some examples of the equipment that we build on the bottom of the slide. A little bit about our company. We're celebrating our 115th year. I've been with the organization for 16. We're privately held. We're in our 5th generation of the Miller family. Our office and manufacturing facility is in St. Nazianz, Wisconsin. Over half of our equipment does leave the United States, either to Canada, Australia, South Africa. We have some equipment over in Russia, some over in the Ukraine. We employ about 275 employees in St. Nazianz. We're represented by John Rubat of Willis. John is here as well today. We cover approximately 135 families, 85 singles. We maintain a low $500 deductible, 80/20 coverage. We charge employees about 22% of the estimated of our expected costs. We're very open with our numbers at Miller. We share all our profit numbers with everybody. We share all the healthcare expenses with everybody. We let them know this is exactly what it costs us for health insurance. Your premiums are set up at about 22%. So if you, the employee, can keep the cost down, it's going to help you and it's going to help everybody in the long run. We have a profit sharing plan. 5% of our profit goes into a profit sharing plan, and we share that amongst all the employees at the end of the year. This last year, we handed out profit sharing checks of 8.4%. So I have an easy sell when I talk about healthcare and say, how can we keep our costs down? Because they know it's directly going to affect their profit sharing plan. It goes right into their pocket. It's a bonus check we give to them. And there's a lot of happy faces when you give them a month's salary at 8.4%. I have an easy sell. So why Cypress? Well, we switched to Cypress a few years ago. Primarily, we switched, I think we've been with Cypress 5 years now, I think, Renee, roughly. We switched for a few reasons. One is health payment systems. Now, health payment systems, I think, is primarily Wisconsin-based. Well, we were able to receive better discounts through health payment systems. I'll talk about that on the next slide. We were able to get a better stop-loss contract. I like the local TPA. Thanks, Tom, for actually, you can pronounce St. Nazianz. You actually, that's actually important. to us when we can talk to people and they can actually speak the language from our area and know the cities. And we felt Cypress would better manage our account and our money. So why did we go with health payment systems? Health payment systems, for those of you that aren't in Wisconsin, it's a quick paying system that pays the employer and the employee portion within a set time frame. Did I say that right? Is that pretty much what? Okay. We received deeper discounts, probably an additional 15%. Our yearly savings is probably about $150,000 to $200,000 because we switched over to the Trilogy HPS network. Plus, the employer receives only a 1 monthly statement. They receive the family statement, and that was important to our employees, and they enjoy that. We also implemented Partners RX, now Magellan. The reason that we had switched to Partners RX, we were with Medco prior, or are they Express Scripts now, I believe. We switched, if I recall, Express Scripts, I think had a falling out with Walgreens at the time. Recommended by Cypress as a good vendor. We're looking for more individual customer service, transparency in claims, and really improved service. And I think we hit all of our goals by transferring over to Magellan. Some of the things we did in self-funding, we're partially self-funded. We've increased our spec over the years. We're now at an $85,000 spec to keep our fixed costs down. We added a $40,000 aggregating spec. And we also added the organ transplant carve-out, which I know we've talked about yesterday as well. We take a look at cost control. Primarily do that a lot with our agent, with John. We look at claims analysis that we receive from Cypress to drive programs for cost control, plan design, employee communications, wellness, which I'll talk about real briefly. Market review of cost-effective programs, and employee education, which I think is a common theme here. So briefly on our wellness, this is our wellness mission statement. We started our wellness program about 2 years ago. It has really taken off. I think we have a wellness presentation coming up next. So I'm very curious and interested to see what we're going to talk about in wellness. What have we done? We've implemented health risk assessments. We had a weight loss challenge, health awareness classes, Get Active campaigns, blood drives. We purchased Pebbles. I think Adam talked about that yesterday. That all their employees have pedometers. Ours is called the Pebble. We implemented employee assistance program, family activities, where we'll do a number of different community events. We offer healthy food options at company events. And we also implemented a tobacco cessation program. We no longer have tobacco on campus, very similar to what you've done. And it's amazing, the change that's actually, how that's taken place. A quick story, we actually had a supervisor prior to being tobacco-free, and about every 2 hours, she actually would kind of walk around and gather her employees and say, hey, come on, it's time for a smoke break. And, we allowed it because we're a fairly laid-back organization. We allowed smoking on campus. So she would actually gather her employees, go outside, and 10, 15 minutes, they'd come back and back to work. So we started the tobacco cessation program. I think Adam said they actually give their employees $1,000. Yep. Curious what other people do, if anybody actually incentivizes their employees to stop smoking. Some of our success stories with wellness, we had 64 participants in our weight loss program. They lost 935 pounds, which is about 14 pounds average per person. And it just floored me to actually, this was one of the first programs that we kicked off, and it was amazing. Our health risk assessments, we don't use it as a stick, we use it as a carrot. And we've often had that discussion, John and I. Do we want to tie it to premiums? Do we not? I'd be curious to see how many employers actually tie it to their premiums, or is it mandated that you have to have your health risk assessment to get the health insurance? We take a little bit different approach. We haven't mandated it, but we want our employees to participate in health risk assessments. Well, we have about 45% participation rate. I don't know if that's good or bad. At some point we may mandate it that you have to have the health risk assessment. But again, we want our employees to be engaged. We don't want to force them to do it. We want them to be part of, controlling costs, and how can they do Blood drives. We had two, I think our third blood drive is coming up next week. We had 85 donors, which we're told saved about 225 lives in our community. On our pedometer, or our Pebble program, we have 85 participants that are involved in various step challenges, and it's amazing how competitive these events have gotten. The first time, we started this in January, so we're in our third or fourth competition. We had an individual that got up at midnight and started riding his bike because he wanted to be the first one, on Monday morning or whatever, Tuesday morning, to show that he had, 500 or 1,000 steps. It's just amazing how competitive this program has gotten. Got a little bit of feedback from some of the supervisors because, the feedback is hey, we're trying to do lean manufacturing, so it's all about, let's not have our employees take all these steps, right? And here we are implementing this type of a program which incentivizes people to take steps. So it's kind of interesting dynamics internally, but I think the program has been wonderful. So, oops. So that's my story at Miller St. Nazianz, and I think what I'd like to gain out of this panel is really what other employers are doing. We talked about medical tourism, and I know Renee and John had brought it to my attention a few years ago. It's one of those programs at times you kind of roll your eyes at, and you're like, okay, which one of our employees is actually going to go to wherever, Omaha, Nebraska. No offense on Nebraska, but why would our employee want to go there and to hear some of the stories where Adam said, well, he sent his Aunt Denise and his uncle there, and they paid him $2,500 because it ultimately saved money on the plan. And those are things I'd like to take back and really truly think about. And if our employees, I know our employees would be willing to do it. Maybe it's something we really ought to take a look at. Transparency. I think Doris, you're doing. I'm going to pronounce it wrong. Alethius. Thank you. I'm curious if anybody else is doing that, and how is it working?
Yeah, and we had Alethius here last year
Yeah.
giving their preliminary presentation, so yeah, we'll talk about that. All right, great. Well, thanks, Brian. Appreciate it.